When we measure solid tumors like lung cancer or breast cancer, often we're just using an X-ray to see the size of a particular tumor. In liquid tumors, it's a little bit more complicated. So in multiple myeloma, we have lots of things to measure. We measure the amount of plasma cells in the bone marrow. We measure the level of the antibody in the blood, or that immunoglobulin. Sometimes we call that antibody or that bad protein in the blood an M spike. Why do we call it that? We call it that because it's a monoclonal spike. Remember how I said cancer is identical growth? Well, this protein, this antibody, are not all the different kinds of antibodies that you make to fight off infections. It's one exact antibody it keeps making more of. So it's called monoclonal compared to our usual antibodies, which we call polyclonal. And so it's important to measure that M spike when we measure it in someone's blood. But there are even some patients where we can't measure the M spike because this protein or this antibody is made of a big bit and a small bit, what we call the heavy chain and the light chain. And there are some patients, about 20% of patients, who only have a light chain. So when we measure myeloma, we not only look for the M spike, which looks at the whole thing, we look for those light chains, and so we do what's called the serum-free light chain assay.